Hello everyone. Am I audible, visible? I don't know what is the glitch is coming in, but hopefully this will work. Hello everyone. Wish you all very happy World Menopause Day. And today, after so long months, I can say I am here on live. Thank you so much joining me. And today we are celebrating this World Menopause Day, and we have with us in some time. Before that, I would like all of you to put your questions related to menopause so that we can cover in our talk. So, welcome, Dr. Sarita. How are you?
Hi. Hi, Dr.
Okay.
Newton. Can you hear me?
Yes, I can hear you. Yes.
Great to see you after a long, long time back on Insta Live.
Yes, same here. So today is special day for all women out there, and that's why we thought of, organizing this event, and I'm happy that you are here with us. Hopefully, this session will be enlightening in your presence. So, can we start?
Sure, sure.
Yes.
Please. I'm looking forward to this
Yes.
discussion interaction.
So all my followers and Dr. Sarita's followers, I know that you are aware about the background of Dr. Sarita, but still I would like to share some important things about Dr. Sarita. She is a urogynecologist practicing in Mumbai. She has 21 years experience in this field, and she is the person I know personally as the great human being with whom you can share all your worries. Even she treats psychological aspect of women's life, uh, as well as there are a lot of things which we don't speak openly regarding the sexual well-being. So she is the person to whom you can reach immediately, and she will be the guide for the next. So let's get started. As we know that today is menopause day. So Dr. Sarita, first let's start with the simple question. What is menopause and what are the common signs and symptoms?
Right, right. Just like, there are so many phases in a woman's life. I always say, let's not put a negativity or a negative word to menopause, that it's an end of the reproductive life or it's the decline of a woman's life. I'll rather say it's a milestone of
Yeah.
a woman's life. Just like a small baby starts from crawling, then starts walking, then starts running, sits down, move around, play, and there are different milestones of life a child achieves. Similarly, a girl's body system, starting from puberty, when a girl starts having periods and achieves one milestone of the hormones. This is the second milestone, you can say, where the reproductive phase has done its job completely. And now it's the second part. So a woman's life part two, you can say, rather than saying the end or lived happily before and not after. Not like that. So definitely I like to make the definition of menopause more inclusive as a phase of life where your periods are going to go away. Now, how much changes it brings in, like you say, symptoms. When we say symptoms, it sounds like menopause is a disease going to hit
Yes.
us all, isn't it?
Yes, true. True.
So at times I feel, though I want to talk about what changes it may bring in a woman's body, and sometimes when I look at our textbooks, when they describe symptoms of menopause, as if menopause is a big disease,
Yes.
while I
We
want to
need to
feel
change terms.
we need to change, at least we need to use appropriate words which are not derogatory, which are not putting down a woman as if it's the end of their life. I'll
Yes.
rather use something as what changes it will
Hmm.
bring. Now, like you said, changes, I broadly categorize them into two. One is period related and one is something other than non-period.
Hmm.
Periods definitely are bound to go away slowly.
Hmm.
So, you can take it as one third of the women will have suddenly stopping the period.
Hmm.
One third will have period getting less, and then fading away.
Hmm.
One third will have, let us say, a upheaval of a surge of up down hormones in a very disturbing phase where periods are irregular, heavy,
mm,
long,
mm,
painful, and then they go away. So
mm,
this is period-related issues which a woman may face, while the non-period related issues will be mood swings,
mm,
hot flashes,
mm,
sleep disturbances. It's a transition phase where your body is getting adapted
mm,
to a non-hormonal phase of
mm,
living,
mm,
where there are those peaks of hormones and cyclical variations are not going to happen more.
mm,
So, mood swings, hot flashes, sleep disturbances, weakness, fatigue, irritability,
mm,
sometimes very depressive phase, sometimes maybe aggressiveness, sometimes agitation, anger outbursts,
mm,
body aches, pains, fatigue,
mm.
memory, issues, fogging, what you call as mental cloudedness, mental
Yes,
fogging,
yes.
loss of sexual desire,
Mm,
intimacy related issues, urinary issues, recurrent urinary infections,
mm.
bladder control problems. Now, when I say all this, every woman starts getting jitters. Oh my God, all this is going to happen to us. The answer is no. A lot of it is, it's like depends on how you take care of your body,
Yes,
how you are
yes.
aware of the symptoms. So, in a brief, this is the spectrum of symptoms, and not one will have all, and
Mm,
not all will happen to all.
mm.
And some may
Correct.
smooth sail very smoothly through this
Mm,
transition.
mm,
Some may have a very difficult phase.
mm,
Some are able to cope up because the support system is strong.
mm. So it's basically it is on individual body and mind how they kept it, right?
Exactly.
And it's
Exactly. And
not
that's
that,
where I
yeah,
keep involving Ayurveda in my consults. And that's where I say that there is a very limited work which modern science can do. And
yeah.
so much, so much, so much emphasis on lifestyle, on a holistic care is important at this phase. And that's where the ball keeps going back to you, Dr. Norton, where I would like that at some point you also highlight the need of care.
Yes, yes, you are exactly, saying correctly. Like, as we said, that menopause is not the end of life or not even end of reproductive life. You can continue the part where the you are able to give birth to baby. That only
Mhm.
the biological part is just now been over. Now you are moving further. There are so many other functions of reproduction that continues. And to take care, yes, in Ayurveda, like we said, Ayurveda is science of life, or it is also science of consciousness, how conscious you are since starting, since the beginning. Like you said, puberty is the start of showing the periods in women's life, right? And
Yeah,
menopause is the other end where you are just stoppage of that period. In
yeah,
between that, what you do with your body, that is very
right.
important thing,
True,
right?
so true.
So Ayurveda gives us that lifestyle, daily lifestyle or seasonal lifestyle where we say dinacharya, rutucharya. So you need to be aware and be taking care of your whole body right from that age, so that
So
you will
right.
age gracefully and your menopause will come and you will not even realize that you are, at this stage.
Exactly.
You're still
So right.
shining the way you are at the puberty time.
So
Right?
true. So true.
So,
Right.
so this is what I always say, that you have to expand your consciousness right from the starting, taking care of your body. And every body is different. Like Vata, Pitta, Kapha, we have the energy channels.
Mhm.
So some people have the dryness more, or Kapha people may not feel that dryness because they have mucus, they have lubrication element in them. And hot flushes which women feels, they are mainly of having that pitta energy more. That's what I always say. So Vata and Kapha people may not have hot flushes as a symptoms of menopause, but pitta have that. So for that you need Ayurveda doctor, and I'm glad that our combination really make it easy.
Yes. And
uh,
so true, Dr. Nutan. I feel so grateful to the universe that it has connected us because I have realized every science has a role to play.
yes.
And Ayurveda, I will say we supplement it, and Ayurveda helps so much to our patients, where our modern sciences is like is standing behind them to support them, to take care of them. But there's a lot more which they can do. And this is something which every common person can do. Medical science, not every patient will be able to understand, for that we are there. But what they can do sitting in their home and can
Yes.
help them so much that it is
Yes.
available to every single individual.
Yes.
They are doing a great work in
Thank
it.
Thank you so much. But I'm happy that because of you people around me, that's why I'm able to share this insight. So now let's get forward. So there are different stages. Like you said, some women may have periods, some, fading it step by step and then stop. Some women may have suddenly stoppage of this period and they don't know what happened. Sometimes they may have fear, oh, am I pregnant or what?
True.
So, what are those stages which has been mentioned in modern science?
Mm.
We call it as perimenopause or
Mm.
menopause and postmenopause. So, can you
Right.
explain that?
Right. See, like I said, menopause is a phase. It's a process. It's not an
Yes.
event. Not say
Sorry, we can't. Yeah. Yes. 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 Now I can hear you. Yes.
say. So the thing is that there are, it's a phase. That's what I was saying. It's not an event. It's not a one day, one spot, one point, one time event. It's a timeline.
Hmm.
When you will enter in that timeline is gradual. When you will pass out from this and then move ahead will be also gradual. There may come a peak where the symptoms or the changes can be very intense. There may come a plateau where you are sort of okay with it, and there comes a phase where these changes become a part of you. So we say premenopause or perimenopause, and then menopause happened, and then it becomes postmenopause. Now, to give simplicity to this whole timeline, a person can start feeling a lot of symptoms before period gets disturbed.
Hmm.
Like somebody who is actively involved in intimacy, who is sexually very active, may feel the changes in the vaginal dryness much earlier than someone
Hmm.
who is not into a relationship, not very intimately involved in an active sexual relation, but is like can pick up period changes very fast. While once
Yes.
the periods start getting affected, then you know that there is something happening. Now, the average age of menopause, is roughly somewhere around 50.
Hmm.
So you can assume that in Indian Asian women, somewhere at 48, 49, we expect some changes will
Yes.
happen. By 50, she'll be going.
Yes.
May get prolonged till 51, 52. So what
Hmm.
happens where you start feeling it is what your body is telling you. The blood hormones test may not say the same. May say or may indicate, may not indicate. But once it starts indicating, let us say blood test, you come to us and start telling, oh, I'm feeling all these symptoms, or my periods are getting disturbed, or they are getting delayed. Am I getting menopause? The only specific way to tell is to get a blood test done for hormones, serum FSH and LH. If any of our listeners know they have done, they will know that the gynec has asked to do these tests. Now, if the test is showing abnormality, that not say abnormality, but a finding that the hormone levels are going high, FSHL is that means you have entered in a perimenopausal phase. Now,
Yes.
it will take some time. And where is the landmark when I say, okay, the menopause is done? So 1 year, no period, not at all, even a single drop. Then we say, oh, you have attained menopause. So premenopause, menopause, and then postmenopause, that somebody had not had any period for last 2 years is postmenopausal 2 years. Similarly, postmenopause 5 years, 6 years, 10 years, 20 years, 15 years. So there is no one landmark, but yes, one time period came and it never came again. After 1 year, you can label it, okay, she is menopause.
Yes.
After that, even a single spot of blood is not okay. It needs to be evaluated. We will ask for a sonography. We will call the lady for pap smear. But it's a transition. Some people will get period, not no period for 3 months, 6 months, then they get a little spotting. Some people doesn't get for 3, 4 months, but when it came like, like a tap has been opened. So again, it will be started from there. Even the period
Yes.
happened after a long gap. Again, 1 year cycle will start. Then we will say, okay, 1 year no period, then it is menopause. It can still come. So perimenopause, this transition itself may last for 2 years sometime. And everybody is different. So no comparisons.
Yes,
That
yes.
somebody says, my friend has, she had suddenly a menopause, or my mother, my sister. Yes, there is a familial tendency. There is a little bit familial inclination that daughters may follow mother's timeline, but not always. It depends on in which environment you are in. What is your lifestyle? What hormonal things you have tried on yourself? A lot of factors. So these are the phases where we say perimenopausal, menopausal, postmenopausal.
Yes. So it is very clearly defined here in this section that 12 months you absence of this period is very important to define that you are at menopause.
True.
In between, if you are getting period on and off, that doesn't mean it is a transition. You can just identify it is a transition, and it's very important that during this phase at least you visit doctor. Even if menopause or perimenopause is not a disease or not things, doctor should not be only visited when you have
Yeah,
something very much serious.
true.
So so it is very important you should visit your nearby doctor, whoever you trust, to identify and learn about this and how you can take care of this transition. Even in Ayurveda, we take care all this lifestyle which has been given in Ayurveda, daily lifestyle or even the seasonal lifestyle, Rutucharya. When Rutu is changing, when the phase is changing, that is the time where our body, mind try to establish the connection. So during establishing connection, there are some up and down things happens in our body, physiological things. And to take care of that, we need some expertise guiding us how to manage or how to cope up. So
Right.
yeah. So now, perimenopause, menopause, and postmenopause, we understood. Here, somebody, I think Riddhi has said about fear is very,
Mm.
means many people created this fear around this menopause.
Mm.
So this led me to ask you a question about mental health during menopause. Just now we have celebrated mental health, World Mental Health Day in our
Right.
last weekend.
Right.
So that
Right.
is very important part for every woman here who are reaching towards the 40s and in between 50.
Yes.
And
Yes.
physically their body says a lot and they are confused what is happening with them. Mentally also they are not clear. So what is your advice for those women?
Right. See, the thing is, one thing is, like you rightly said, a doctor should not be visited only when you are sick.
Yes.
It is, in fact, this phase, 40 to 50, midlife, what we call, it's not the end, it's not the beginning. You're somewhere in the middle because with modern medicine availability and the advances, the human life expectancy has gone to 80s and 90s also because health facilities are there. We are picking up conditions early, we are resolving them. The only thing is quality of life is what matters, and there comes the role of mental health.
Hmm.
Now, important is that this phase is a good time to enroll yourself into regular annual health checks.
Hmm.
Because by this time, most of us have completed the families. Kids are grown up, they are on their own life path. Families are sort of settled, personal grudges, relationships are generally going in a stable phase. Like for some, it may bring a lot of stability, while for some, this hormonal upheaval can, make them very vulnerable and prone because kids are flying out, they're moving out. There is a sort of emptiness there.
Hmm.
The relationship, though it is less stressful now, but there is a certain level of monotony. There's no
Hmm.
need to prove to anyone among the partners that, that blame game and that kind of nudging of husband and wife is generally settling. But then also there is some kind of monotony falling in a daily routine. That
Hmm.
the settled routine is going on. There's a very monotonous kind of life path going on. Those who have left their profession long back for the family, now they suddenly start feeling empty. Now,
Hmm.
so there is a lot of vulnerability.
Hmm.
So talking about it helps a lot
Hmm.
rather than blaming everything to menopause or blaming everything to situations. I think both plays a role. A lady who has a very well supported system is supported well with the hormonal changes.
Hmm.
While
Hmm.
someone who has a very dysfunctional kind of situation around them, maybe it is profession, maybe it's at the family, maybe it's relationship, maybe kids going out now, having their own lives, and you feeling left out, and they're having those kind of resentments that what about me now? I sacrificed so much for all this, and now there is no one to take care of me, while everything is okay. And this is the hormonal rush and hormonal turbulence which is hitting them.
Hmm.
Now, how will you know?
Hmm.
How a layman will understand as a patient that
Hmm.
what is happening to me?
Hmm.
So I've seen n number of women breaking down, crying bitterly when touched upon these emotional aspects, and they keep on sort of brushing it away, ignoring it.
Hmm.
नहीं कुछ तो है नहीं सब तो ठीक है फिर क्यों मुझे रोना आ रहा है?
Hmm.
They know there is something troubling them, but then they are in a sort of denial कि अब तो सब ठीक है, or they want to talk and the family person is not able to sort of extend the help, and they are highlighting again सब तो ठीक है अब तुमको क्या प्रॉब्लम है, सब तो ठीक है अब तुमको क्या प्रॉब्लम है, सब तो है, गाड़ी है, ड्राइवर है, सब कुछ है, तुम जाओ घूम के आओ, and she is still like bitterly crying कि मुझे ही नहीं पता मुझे क्या हो रहा है, what's happening. She's irritable, she's angry, she's cranky, she's not able to express what she wants, and everybody is trying to just कि आपका तो हमेशा ही आपका तो even kids sort of they are busy in their work. So what is needed at this point is a patient listening ear, and
Hmm.
that's where counseling helps so much. A
Hmm.
safe space where a person can open up and is
Hmm.
not judged, will not be given any labels. And a
Hmm.
very close assessment medically that are these just signs of emotional fluctuations
Hmm.
or there are clear-cut signs of endogenous depression.
Hmm.
So there a good counselor or a gynec who has a inclination towards listening or a holistic person like you who gives importance to these symptoms. Again, we are saying word symptoms, but this is a phase of emotional vulnerability.
Hmm.
Unless there is one person who is looking, towards these and is trying to see are they pathologically more,
Hmm.
we end up ignoring so much of discounting we do to our own emotions. We try
Hmm.
to be perfect everywhere while
Hmm.
the need is not there. So that emotional mental well-being plus the
Hmm.
fear of cancers. मेरी इस फ्रेंड को ऐसे ऐसे मेनोपॉज के टाइम पे कैंसर हो गया था, मुझे तो नहीं हो जाएगा,
Hmm.
मेरे ब्रेस्ट में मुझे लंप फील हुआ है, नहीं आप चेक करो, नहीं
Hmm.
मैमोग्राम कराते हैं, नहीं सीटी कराते हैं, कुछ हुआ तो कुछ लोग आएंगे ही नहीं चेक करने, कुछ
Hmm.
निकल आया तो anxiety becomes so much. If
Hmm.
there is abnormal bleeding or discharge, they don't want to go to hospital. मुझे
Hmm.
डर लगता है इसलिए मैं गई नहीं.
Hmm.
So that's a very high level of anxiety,
Hmm.
which is making them dysfunctional, making them not to take action, which is not okay.
Hmm.
While unless they talk about it, who is going to take care of these bills? And the answer lies in the healthcare provider, whosoever it is,
Hmm.
to run the battery of tests, which a person should not mind to invest their time, effort, energy in, because eventually the reassurance is what
Hmm.
which helps that you are okay. It's just a phase. Speak it up. Speak about your fears. Fear of being left alone, fear of being rejected in a relationship because you're not able to perform sexually as you were able to do in past. Fear of sort of getting aged, fear
Hmm.
of not looking so good as your,
Yes.
peers in a kitty party or in a function, fear of not fitting in the clothes because you have put on those extra kilos.
Hmm.
How can it happen to me? I've started hating my own body. I don't like myself. So much of self sabotage and
Hmm.
self-defeating talks to your own self in your own mind. Unless you speak it up, I cannot help you. How will I help?
Hmm.
Speaking helps to deal with all kind of things.
So it's very important what you are, doing talk with self. Self-talk is very important. And to
Yes, exactly.
understand that self-talk, many people don't know also. They are talking with themselves, or their body is talking to them, and they are not able to listen what their body signals are. And here I would like to bring yoga practices,
Yes.
because AYG Academy is actually, as you know, that we promote Ayurveda, Yoga, Garbha Sanskar along with modern science, of course, everything together. So yoga helps in this conversation which you keep on doing, or your body is telling you something, how you can awaken that state of mind where you are keeping yourself in balanced state
Yes.
and listening to body signal on time, reaching the right help. Just talking to somebody, it literally resolves many issues, you know. You just
Mm.
need someone to talk. You have said it that, yes, you just need listening, ears,
Yes.
and you just say, and you will find yourself completely relaxed and good enough. So yes, you should have someone, you know. It is said that you are that person, five people who are around you. So somebody has said this, and I really, you know, took that message every time whenever nowadays I speak. So you need to identify, at least when you reach to menopausal age or after 40, you should be, in fact, consider yourself lucky that you are still in the life. You know, you
Yes.
are still present, and you have so much wisdom with you. You have so many insight, experience, which many people do not have it. So what you have, if you focus, I think mental health can be definitely managed with the focusing on the right things, and using your knowledge, experience for the current, for yourself first, and then obviously for the people around you. So
So right.
in fact, I feel lucky because I am also in this phase. At my periods and everything is fine. Now there are pathological reason also. Sometimes periods get, you know, up and down. Like I discuss with you, you know, uh, we have so many people around us, but we don't discuss. And we are lucky, Miss Dr. Sarita and me keep on discussing our personal health issue also
Yes.
with each other, getting the modern help from the Sarita ma'am, and then Dr. Sarita asked me about Ayurveda. So even my periods also became little bit in between, you know, absent.
Right.
And then when like we did the whole checkup, where I found that thyroid level is little bit up and down, and due to that, periods get, you know, little
Yes.
bit delay. But now again, doing some practices or doing yoga practice and Ayurveda treatment help me out to come back to my regular pattern of flow.
Good.
So that's not the menopause. So pathology identifying is very important, seeking help and getting into that particular channelization.
Good.
So yeah. Uh, Next, what you tell me how you manage yourself. There are so many issues, like in Ayurveda, it is said that your reproductive system, if it is healthy, if your periods are healthy, means your all dhatus in your body
Yes.
or your all systems are working well.
True.
But if your periods are showing some things, then there are some problems in your earlier dhatus.
Right.
So you tell me those pathological reasons why some women have this irregularity before achieving that perimenopause phase.
Mhm. See, like exactly what you said in Ayurvedic terminology, that your elements are disturbed. If the periods are disturbed, they are telling a lot. Same thing I use so many times when I'm talking to my patient in a very scientific way. Same thing. Modern science is basically a modern version of what I say Ayurveda in a different language, I will rather say. So, a girl or a lady who is getting regular periods, regularly happy, healthy periods with a normal amount of blood loss, with normal manageable cramps, tells me so much that the person's body, mind, thoughts, hormones are so much in sync. It in general tells me that if someone has come to me with vague symptoms, vague pains, vague headaches, migraines, vague kind of stomach upsets, a lady who is coming and talking to me, पैर दुखते हैं, stomach upset रहता है, हजम नहीं होता है. My first question is always tell me about your periods because they tell me so much that what's happening in the background. Is there a background emotional issue happening? Is there too much traveling happening? Is there something happen in the house? Is there an exam coming up for the young teenagers? Is there a change of a place? Is there a change of a job? Is there something, which is keeping you sleepless in the night? Night shifts, night duties, sleep rhythm. Has there been a change in place which has changed your food, just like you are in a foreign country right now? The Indian food availability, which your genes, your body is used to.
Yes.
You know, there are so many things might be happening in the background. Sometimes people have taken randomly eye pills. Sometimes they have taken medicines to delay the periods. And now things have got, sort of disturbed. And now they will not tell, they will not think because of this, it might be happening. But I can pick up that. So regular normal period tells me a lot that a woman's body is in sync with its own hormones and its own mental situation, mental health situations. While disturbed periods may have an element of everything. Psychological issues, I'll go into those only once the medical factors have been taken care of, like just in your case. What if we would have never thought of checking a thyroid and would have just assumed that you are under stress because you're traveling, you are put off AYG Academy, your classes are on, आप सो नहीं रहे हो, आप सिर्फ lifestyle ठीक करो. While there was a sure shot, a clear thing inside that there is a thyroid element. You took care of it in a holistic way only because you picked it up. So thyroid, prolactin,
Yes.
other hormonal issues, vitamin deficiencies. People
Yes.
keep on saying मेरे बाल भी गिर रहे हैं, मेरी स्किन खराब हो रही है, ये हो रहा है, मुझे मेनोपॉज हो रहा है. Well, they don't realize that the diet lacks adequate water, it lacks adequate vitamins, vegetables, antioxidants, care is not there, self-care is not there. There's so many elements to it. That first pathology has to be taken care of. Then they say, now my periods are painful. No, painful means, no, I'm stressed, that's why. Last 3 months or 1 year has been very hectic and it keeps on paining. Yeah, itna to pain hota hi hai. My mother also used to get, but without doing a sonography, how can you be sure that there are no fibroids? How can you be sure if there is any ovarian cyst, endometriosis, pathological conditions? So as as much as I am very high on including mental health and psychological parallel problems happening which might be disturbing someone's periods, I really need to make sure that as a modern science gynecs perspective, as a urogynec vaginal surgeon, as a gynecologist surgeon, I need to make sure that there is no organic pathology. Organic means a visible pathology which could be an underlying reason.
Yes.
That's
Yes.
why I say speak not to anyone but to a relevant person.
Relevant person. Yes. Yes.
You
Otherwise,
speak to some.
women just speaking, sorry to interrupt, women just speaking with the friend and just what she is taking, so I will
Yes,
also take. She is taking
exactly.
vitamin D, I will also take. No.
Either they get too scared because someone else has added an element of fear to it. ओ हाँ मेरा भी हुआ था, मेरा ये हो गया, मैं तो गई डॉक्टर के पास, उसने तो मुझे सर्जरी बता दिया, उसने बोला यूट्रस निकाल दो, ये कर दो, वो तो ये वाली गई ही नहीं, मुझे भी बता देंगे. While every patient may be different, या किसी ने बोला हाँ मेरा तो था, उसमें कैंसर निकल आया, मैं तो ये करा के, या फिर ये इतना ज्यादा डर जाए कि अननेसेसरी अनइंडिकेटेड सर्जरी करा ले दूसरे का
Actually,
सुन
you
के.
bring all those elements to you when you
Yeah,
start
yes,
speaking
exactly.
to this.
Start
Like
thinking.
as,
Yes, exactly. So the thing is, how do we cut short this unnecessary mental churning? Is come to go to a sincere gynac
yes.
who who you have trust, get your blood evaluated, get a basic
Yeah,
sonography if you feel
done. Yes. Sorry, we lost you.
doing a basic check, making sure everything is okay. And now let me look into the mental health factors, hormonal factors, your sleep, your stressors, the environment, the changes which we need to bring in lifestyle. But I've seen that extremes of any approach, it sort of creates an
Yes.
imbalance without making sure there is no, you should not miss, rather, I'll say,
Yes.
an underlying core thyroid issues, ovarian cyst, a fibroid, cervical, lesion for a bleeding pattern, that without a pap smear, how will you say?
Hmm.
Vaginal discharge, one should take a vaginal swab. So get yourself evaluated, and then you are in a safe zone. Now you go and work on your lifestyle, bring those positive thoughts, meditate, follow certain rituals in your sleep, and then things fall in place.
Yes. So, in fact, what you have just said, let me summarize. So, we need to go ahead with the regular checkup, at least annual or semi annual way, to
Yes,
get
right.
checkup done. You have signs, symptoms or not, that is a different thing. But once you cross 40, you start going to pathology center by yourself, and there are a lot of things which you will see. Even pathologists can guide you, or you can also talk to your doctor. Doctor will give you some test which is relevant to you, and then you can get the checkup done. Once the reason identified, once the things get identified, then you will start your rectifying those elements, and lifestyle, food, everything becomes very good. And in Ayurveda there are a lot of things, panchakarma, which I did personally on myself when I got to know, oh, I have thyroid. So as Dr. Sarita knows, she knows very well. She told me to take this tablet. Sorry,
And you did not.
since I thyro now, but
That's
you know that I
okay.
have just listened, and then I have followed my Ayurveda things,
Yes,
and I have all the reports where it is giving me that yes,
yes,
the level is
that's
coming
good.
down without taking thyro now. But that doesn't mean you should not. Definitely, every body is different and everything is different. You need to. I did work on myself, diet, and then doing this Ayurveda Panchakarma Basti, which is very important therapy. And in Panchakarma, we have where you have been given decoction, oil
Mhm.
decoction or medicinal decoction through your anal region, and you will get your stomach clear and your gut clear, and colon cleansing happens, and lot of things getting resetting. So I recommend highly to all the women after 40, please go ahead with the basti. Consult the nearby Ayurved doctor 100% before going to this therapy, and this will give miraculous result of getting back, because this is said that basti is the full, means the half treatment, means the you will, it is a king treatment of panchakarma. So I did that on myself, and it literally given me good result. And now my periods are very much on the way. Every month I'm getting proper flow, my thyroid level decrease, and that's how you can work on yourself. So yeah,
Right. Great.
with this, now let us ask question to all our listener. Thank you so much, everybody who are listening to us. Please put your question in the comment box. Sheetal, Sneha, Neha, Veena, Nivedita, Ashwini. Thank you, all of you for joining us. If you have any question, please put in the comments. We will like to cover. Otherwise, we will have the last uh, question, and the regarding post-menopause, how to manage, like since Dr. Sarita is expertise in sexual well-being, as I said, so this is very important part of everybody's life. Married couple, they are aging together, and but they are still missing each other, going towards the intimacy, because there is a dryness, there is a lack of libido, there is no drive. One partner wants it, other partner do not want it. And even male goes through andropause. It's not only the female. We are talking about menopause, but there is also male going towards this menopause, which we term as a andropause. So, what do you like to suggest for the couple in
Mhm.
this age, how they can keep their sexual health and maintain well-being?
Right. See, now sexual intimacy, a good sexual intimacy, bringing a good sexual harmony among the couple, within the couple, can really go a long way. Especially if it has been there for years and years, it can really help women to sail through this phase much easily. Now, the issue is if there is a conflict in the women's mind. Let's take the women. only first. That if there is a conflict in a lady's mind that, you know, अब तो मेनोपॉज हो गया, अब क्यों करना है, अब तो एज हो गई, इनको यही सोचता रहता है, बच्चे बड़े हो गए, क्या कहेंगे सब, you know, that kind of grooming in the mind, that kind of thought process where a lady is fighting with her own self. Yes, I agree that with the hormonal decline now, the desire component, the arousal component, the lubrication component may not stay as intense as it was. So the challenges happen in the penetration part of a sexual act because the vagina becomes dry slowly over number of years. If it has, the activity has been really pushed away, the vagina may actually shrink and narrow down. So now if they want to resume, it is far more difficult because it has shrunken. So we encourage to not sort of totally reject it and try to find a right balance. The problem happens only and only when there is a disproportionate desire or need in the partners, where the male partner has still a very high need and the lady is going through a perimenopausal or menopausal phase and the desire component, lubrication component, arousal component has fallen drastically, or she's still sailing through it, over that phase. Still in that kind of mental, health issues, period रुकता नहीं है, pain होता है, exhausted है, and doesn't feel like, right? So in these two extreme, that एक बहुत high need है, एक की बिल्कुल खत्म होती जा रही है, और irritate होती है when the partner approaches her, all the more want to push her because she started sort of disliking her own body. Now, problem happens there where the act per se is seen as a physical act, which
Yes.
is needed to be done
Yes.
just to complete it,
Yes.
get over it, have an orgasm, ejaculate, and move away from this. You know, problem happens where this act of intimacy is seen as a physical act of pleasure. While the couple who evolves together and start giving importance to intimacy rather than intercourse, they discover and rediscover and enjoy and re-enjoy another level of intimacy, more on, you can say, maybe spiritual side, maybe another level of togetherness, when they
Yes.
look at as a sign of togetherness. So defocusing from the penetrative intercourse and focusing largely on feeling the sensations of being together, and like, very wrongly, or what we can say, lack of sex education in starting from childhood to
Yes.
teenage to adulthood throughout the married life. The focus of sex means penetration, penetration means intercourse, and that's how sex is seen as. While the intimacy, and the moment you say sex, the mind is at the peno-vaginal intercourse. While I would say the most sexual organ of a human body is human skin, which is all over your body.
Yes. It is the biggest
Rediscovering
problem.
the
Yes.
sensations, the touch, redefining what you like, what you dislike, what you will not like, defocusing from those areas which give pain and focusing on which gives you more relaxation together. Bringing down that excessive desire of one partner to a medium level and raising the lady's desire to at least maintain, so that none of these two partners feel rejected and dejected and left out. That works by talking and counseling and creating this awareness in a safe space in our cabins. And we feel so good as clinicians, as surgeons, as gynecologists, that when a couple comes together for consulting, not only a lady coming and then breaking down and then we're just trying to mend that because it says कि सब कुछ मुझे ही फिक्स करना है अपने ऊपर, आप मुझे ठीक कर दो ताकि मैं उनको पूरा कर सकूं. While there comes a couple where they are both sitting together and the male partner, the husband, also want to know what can I do to help her, rather than blaming and sort of, शिकायत करने के लिए कि इसका तो कभी मूड ही नहीं होता है, इसको तो प्रॉब्लम ही होती रहती है, आप ही देख लो, आप ही कुछ कर दो, and putting all the full onus to the lady. So it is good when a couple comes together, when the husband wife comes together and we openly discuss what's happening here. Are the expectations too high? Or it's the belief system? What is the hindrance here? Is it only the lubrication issue? Then we have plenty of jellies, KY jelly, lube, locks, which can help. There's so
Yes.
many vaginal treatment, just like for your external skin, people do hydrofacial and things like that these days. Similarly, there is vaginal rejuvenation therapies available. There are a
Yes.
lot of things, laser, radio frequency. If the need is there on both sides and they are finding a problem, the treatment therapy modalities are different. So I have, you can say, oldest couple of 69, 70, still very active.
Mm.
And when they come and talk to us, we have to tell them that the body has its limitations. So be gentle, use lubrication. May not always have a great orgasm, but still they are together and they're happy
Mm.
because expectations are balanced. Help
Mm.
each other to have their respective pleasures,
Mm.
and they enjoy intimacy to another level.
Mm.
While if there is a disproportion and there is a blame game happening, ये तो ऐसे ही है, इन्हें तो और कुछ चाहिए नहीं है उम्र में भी, और इन इसने तो आज तक मेरे को कभी नहीं दिया कुछ, अब तो और भी इसको बहाना मिल गया है मेनोपॉज का.
There are a
We
lot
have
of things
all
going
kind of
around.
dialogues going on that sometimes we really have to bring them to a neutral zero level by just hearing them out separately.
Yes.
क्या
Yes.
आप क्या सोचते हो, कैसा होना चाहिए, क्या एक्सेप्टेबल है, आप ही बताओ. वंस अ वीक, ट्वाइस अ वीक, वंस इन अ मंथ? नहीं, इतना तो होना चाहिए ना, मैं इतना सब मेहनत करके आता हूँ. वी हियर ऑल काइंड ऑफ
Mm.
dialogues happening, active dialogues as well as passive, silent, passive aggression,
Mm.
and then blaming each other.
Mm. Yes.
So there are a lot of variety, but they can be helped by
Absolutely.
counseling, by medical management, by medical help, by lubricants, a lot of things. So help
Yes.
is there. It's
Yes.
just that they need to open up and
So,
discuss.
yeah, you rightly picked up that it's not just the physical intimacy, it should be spiritual. When you reach at certain age, it's not just the skin to skin contact, it needs the spirit to spirit contact. And yes, at least that much wisdom every couple needs to bring it together when they grow. That's how we can say growing gracefully, right?
Yes.
Now there is a question, one question which has been there in the comments. If you can read, Veena
Mm-hmm.
Rao
Mm.
She is saying that,
Yes, yeah.
yeah,
Spotting problems from past 14 years. Have taken hormone tablets but no use. What are the causes of spotting 8 days before normal menstruation? Veena ji, I need to know a lot more here before commenting anything. I need to know your age. I need to know your sonographies. I need to know your, again, hormonal evaluations. 14 years old long problem, and spotting is happening always before periods. It can be a complete spectrum of hormonal disturbances, uterine polyps, ovarian cysts, a lot of things, cervical issues, so I need to know your pap smear, I need to know all the tests before I label it that it is a perimenopausal change. Very difficult with this limited information because it's a complete chapter in
yes,
its own self. That premenstrual spotting, 8 days before periods, always happening. Past surgeries
yes,
has been a previous cesarean, past uterine fibroid surgeries, any residual fibroid,
yes,
polyps. So there is such a long list of causes of this kind of problem where with this info very difficult for me to answer. But
yeah.
we
So,
need to see talk. So
yeah,
you can freely connect with us, any of us, either Dr. Nuthan, if you want the Ayurvedic approach first, you can connect with me. If you want a modern science approach, and I'm sure it's 14-year-old problem, you surely must have seen doctors. I need all those reports to review
yes,
and we can talk
correct.
there.
So, all of you who are listening to us and Veena ji, like Dr. Sarita said, personalized problem, you need to definitely get evaluated properly. That needs to connect the dots before what happens currently, what is there, and how many doctors you have visited, what are the treatment you have taken, so that we can give you correct way of rectifying your issue. So thank you so much, Dr. Sarita. With this, I think we can conclude this session, and it was really nice to talk to you and explore this topic, menopause. The more we talk, there are a lot of things to talk on, but the main thing which we have covered, what is menopause, what are the types, stages, and how you can manage with the help of modern science, and there are some Ayurvedic perspective. And this is just the transition, this is not the disease. What menopause is not, that is very important to understand. Then what is menopause is, right?
Yes.
So menopause is not a disease, menopause is not just the things which you need to worry, or just take it as a kind of fear factor in your mind. Everything, if you are clear about the concept of menopause, it is just the phase which is needed to be treated like the every other phase you go through. In fact, I feel more better when I am at this age. And number one thing which you need to accept yourself as it is, whatever your skin may be. There might be depigmentation you can see on me.
That's true.
That doesn't matter. Whatever your body weight, whatever things, definitely we need to work on everything. There are solutions nowadays. It's we are living in this artificial intelligence world where you will have to just click one and you will get the solution. There are a lot of Instagram influencer also there who are giving you a lot of solution. But yes, the important part to take home message from this talk is you need to have expert advice, personalized consultation. Anything if you feel discomfort and finding little bit different, just listen to your body signal. Sit with that all the things which is happening for some time. When you start your day, when you end your day, your body is literally speaking to you. So you need to just listen to that and then program yourself how you can just take the help, seek help. And seeking help is not just you are getting vulnerable, but you are getting solution to the problem so that you will live your life qualitatively. Quality of life is very important part when you age. And thank you, Dr. Sarita, for giving this wonderful understanding about the whole topic. We will continue our talk in future as well. Wish you all very happy World Menopause Day. And if any question you have, you can keep asking us below this talk, which we will be putting it on our Instagram page. Dr. Sarita also may have on her page and on my page, and we will answer. Thank you so much.
Thank you.
Let's
Thank you, Dr.
conclude.
Nutan, for
Bye
having me
bye.
here.
Take
Thank
care.
you. Bye.
Yes.
Bye. Thanks.